A new report released by the CDC just hours ago highlights the contrast in vaccination rates among children of different races and ethnicities. The report is based on data from nearly 100,000 families. Our Paula Suro has been digging through the numbers. She's joining us now. And Paula, this is the first report giving us a close look at vaccinations among children.
That's right, Jennifer. You know, we've reported extensively on the differences in adult vaccinations, race and ethnicity. But when it comes to children, the same info has been limited. This brand new CDC report shows Asian and Hispanic children have higher vaccination rates compared to other ethnicities. A Hispanic mother who has yet to vaccinate herself and her 4 children says she is surprised by this. This CDC study released hours ago shows new information on vaccination rates as of August 31st for children. It shows more than 33% of kids 5 to 11 years old are vaccinated, with vaccination rates increasing to nearly 70% for older teens. Angie Davalos's 4 children are not part of those percentages.
I respect people who want to get their children vaccinated, but I don't plan on it. God has saved us so far, and unless something else comes up in the future, then maybe. But for now, we have the same beliefs.
The study also highlights vaccination rates for children ages 5 to 17 of different ethnicities and races, with more than 75% of Asian children being vaccinated and more than 49% of Hispanic children having at least 1 shot. Only 43% of Black children have been vaccinated, the lowest percentage of all groups. Davalos, who is Hispanic, says the results are surprising.
It really makes you think. I wonder if it has to do with all of the outreach in our language, which I've seen a lot of within our community. I've seen a lot of Spanish commercials to get the vaccine. I think that worries people and makes them want to get the shot.
The CDC found the higher rates were among children whose mothers obtained a college degree, lived in a household with a yearly income of at least $75,000, and had received at least 1 influenza vaccine dose. Dr. Jane Morgan with Piedmont Healthcare says public health experts have played a big role in raising those percentages.
Certainly, we made an effort to make it more language accessible. I mean, I do something called the Stairwell Chronicles, where I explain about the vaccine in 60 seconds. I began to add Spanish subtitles to those. And I think people like me began to make that outreach, and that was very helpful.
Now, Dr. Morgan also spoke a lot about efforts to get minorities vaccinated for COVID. So coming up at 6, she discusses solutions that could increase those percentages in the Black community.
Really good reporting there, pal. Thank you.